We are on the road with Dr. Deborah Boland, the only mobile neurologist in the Tampa Bay area, shadowing her as she makes house calls.
Hi, how are you?
Thank you for having me, Dr. Boland.
Thank you for coming to join us today.
Absolutely. Now, let's talk a little bit about your background. You started out as a physical therapist, right, before deciding to return to school to become a neurologist.
Correct.
Tell us a little bit about that journey.
I, went to high school and college straight through, and that was back in the day when physical therapy degrees were master's levels programs. So I went through a program that transitioned me right from my bachelor's to my master's, got out in my early 20s and started working as a therapist.
Dr. Boland worked for 10 years as a physical therapist before returning to medical school to specialize in neurology.
It was a drive inside of me really to want to know more about neurologic conditions and what was going on with the patient and why doctors were making decisions they were making for patients' health care in the patient population I was treating. So I could make that choice and I had that option, so I chose to go back to medical school.
House calls made up 40% of U.S. doctor visits in the 1940s, before declining in the late 1960s. House calls were very common, where doctors would grab their little bags, like you have one right there.
I do.
That's always how I picture, old-timey doctors showing up to the house with their bag, and they would give you your exam there. Why do you think we got away from it as a healthcare system where they're just not common at all anymore until people like you come along?
Right. It's a very complex question with many different facets and many different answers. I think there are a few simple answers. One, efficiency.
Because insurance pays such a low amount per visit, doctors have to see as many patients as possible per day. Traveling to each patient's home is no longer efficient.
I think the other reason too is efficiency from services available. So if a patient needs a lab test, many primary care doctors will offer the lab test in their office and they don't have to go anywhere else for that.
However, most neurologists don't have the ability to run labs or take MRIs or CTs in their offices. If a specific scanner test is needed, they can write an order and send the patients to their primary care facility.
What was your sort of inspiration for becoming a mobile neurologist versus just working at a practice?
There's a patient population within neurology that really struggles to get to the doctor's office. And with my movement disorders specialty, I saw that, and a lot of my patients had problems with mobility getting to the doctor's office, and it was cumbersome for the family to get them in and out of the car, walk them in, walk them out. To sit in the doctor's office for hours on end is incredibly frustrating. Why not sit in your home and wait for me?
Absolutely.
And then the dementia patients that we also treat, they can become agitated in the office, their condition can worsen when they're in the office, and so if you treat them in their own environment, they tend to do much better.
It's their comfort zone.
Absolutely, absolutely.
It also allows the doctor to see firsthand the obstacles a patient deals with daily, such as bulky rugs, stairways, awkward furniture layouts, or other impediments that can cause mobility issues.
And now tell us about the patient that we followed you to today, Stephen.
Stephen, so he has Parkinson's disease. When I first saw him right around a year ago, he was starting to just have a lot of difficulty with walking, a lot of difficulty getting out of his home. He was having a lot of mood issues and anxiety issues that would worsen when he would go to the doctor's office at times. So he and his wife chose to join the practice because they felt it would be more convenient for them for me to come to their house.
Stephen first noticed the effects of Parkinson's disease about 14 years ago when his hand began shaking involuntarily. He immediately called to schedule an appointment with a neurologist. After a 3-month wait, he finally saw the doctor and was given the diagnosis of Parkinson's disease.
I had to start coming to a realization that I did have a problem and I needed to face it in some way. So I initially told my doctor I was reluctant at taking any medication. He said, "You might want to use this. You may change your mind." And I did quite rapidly because there's medication out there that can soothe the tremors and you can pretty much stay in a normal capacity for long periods of time.
You know, people think of Parkinson's as as tremors, but it's so much more than that. It has an effect on the whole body system. It affects their digestion, it affects their ability to speak, it affects thinking, it affects their gait, it affects their balance. One of the first things he lost, even before we had any signs of Parkinson's, was the sense of smell.
Stephen attended a seminar at the University of South Florida where Dr. Boland was speaking, and he learned about her mobile practice.
When we heard about this opportunity that would bring her out here on a regular basis, and wouldn't have the problem of getting to the appointment, and as I got worse, and when I'm not able to drive a car, I won't have to worry about how I'm getting to the doctor. I also like the fact that you don't wait on the doctor. She's going to be there at a specific time, and she's there.
Before Dr. Boland, Stephen wasn't seeing a neurologist as often as he should, due to the amount of patients they treated. Stephen felt more like a number than a person.
The neurologists that treat this, and especially the really good ones, and he was going to a really good neurologist, have so many patients that you frankly just don't see the neurologist. You see their physician's assistant or their nurse practitioner. And while they're good, they don't have the knowledge that the doctors have, and they aren't as well read as the doctors are.
Dr. Boland was able to get a feel for his home and family life and how it would help or hinder his Parkinson's symptoms.
It's a very personalized service that you just can't get in the regular medical delivery system. And when you've been around Parkinson's patients for a while, you know that there's so many differences in what they're experiencing as far as symptomologies. So one of the things that she gains an advantage of, and we gain the same advantage, is she's able to see his home and what he has to maneuver in his home. She's able to see that we have a step-down dining room that he has to maneuver through and a step up to get outside. She's able to see that the room is carpeted and not tiled and what kind of challenges that would present him. She's able to see what opportunities he might have on the property to exercise.
The exam in the patient's home is essentially the same as it would be in the office.
We'll talk a little bit about what's going on with them, kind of review their histories since I've seen them last, go over their medications, go over any issues or concerns they might have. Then we'll do a neurologic exam. I'll tell them my thoughts of what changes, if any, we need to make. And we together come up with a joint plan of what we're going to do moving forward.
Like many Parkinson's patients, Stephen was having a difficult time with medication timing and dosage.
As the disease progresses, you have to take more and more levodopa, and you can only take so much levodopa at a time. So then that defaults that you're taking levodopa much more frequently throughout the day.
So what exactly, when you talk about this levodopa, what does this drug do?
Dopamine is one of the neurotransmitters in our brain. In Parkinson's disease, your body's not making enough dopamine. So when your body doesn't make enough dopamine, you become stiff, slow, and shaky. I tell my patients it's the 3 S's, right? Stiff, slow, and shaky. And the fancy terms for that are bradykinesia, rigidity, and tremor. So we need to replace that artificially, and so the levodopa replaces that.
When levodopa is no longer effective or the side effects become too debilitating, deep brain stimulation is the next treatment modality.
We put the electrodes typically deep into the brain. Then you have a wire that comes down, and you implant a battery in the chest, much like a pacemaker. And then I have a programmer, and I can set the pulse width, the pulse frequency, and the duration.
DBS can be used to treat Parkinson's, tremor, and sometimes dystonia.
For Parkinson's disease and tremor, the FDA has approved those 2 diagnoses to do the implants of DBS. For dystonia, because it's a rare medical condition, when we implant those patients, and there's not many patients even across the country who are implanted for dystonia, we go through the process of getting the approvals for that, what's called the medical device exemptions.
And so as a business model, you know, we touched upon the fact that doctors nowadays, just in order to make enough money to survive, have to see a high volume of patients. How do you balance that?
Right. So for me, I chose to step out of the insurance system so I could balance that. I love that I can have a relationship with my patients and that we can together come up with a plan and we can together decide on best medical evidence, best medical research out there, what is best for them. And we don't have to have a third party dictating to us what should be done and what shouldn't be done.
Dr. Boland certainly has helped Stephen, as well as many other patients, manage the progression of their movement disorders.
Perfect. This one?
And by becoming a partner in Parkinson's in their own homes, she continues to provide hope for those suffering, as well as their families and caregivers.
Thank you, Dr. Boland, for allowing me and our whole crew to follow you around today into a patient's house and see the interesting work that you do. It's a fascinating business model and hopefully sort of the path that medicine is heading.
Thank you. I enjoyed having you guys today and sharing the stories.
Thanks so much.